The next patient I'm going to record after I've said who I am is going to be another case, and this patient will have a diagnosis of vasculitis to demonstrate how we capture information for the purpose of the sequin, which allows us to prove to the specialist commissioning bodies that we are performing up to standard for managing these patients with autoimmune rheumatic diseases. So we'll enter a diagnosis of granulomatosis with polyangiitis, or GPA, or Wegener's granulomatosis. Typically a patient might well be on maintenance therapy with rituximab, or Rixathon as one of the trade names is being used now, along with a maintenance dose of methotrexate and perhaps a reducing course of oral steroids, and probably also on a bisphosphonate. That's a typical prescription for somebody with that disease. We would evaluate them using the Birmingham Vasculitis Activity Score, which we call down from one of those green buttons, and we'll reset the score and then start recording, following patient evaluation, items of abnormality. So if they've been losing weight, which we attribute to the vasculitis, perhaps they've got new nodules on the chest x-ray today, and a worsening of their nasal crusting and discharge, and no other items to record, then we can click the No Other button. We can record that this is not their first assessment, and press the Save button there, and we've recorded their Birmingham Vasculitis Activity Score as 9, which is quite high, suggesting they're having more active disease, and probably you might want to accelerate the therapy, perhaps increase the potency of some of the medication. We might alter the treatment choices to perhaps escalate to mycophenolate mofetil up here, and stop the methotrexate, and you might also increase the oral steroid dose to control disease better. So those are the typical treatment choices we might make, and we might continue the Rixathon unchanged but make these alterations to the disease modifying therapies. So we'll save that record again. Here is an error that I've omitted to say when I'm going to see the patient, whether I'm going to see the patient again. So I'll just click that to confirm that, and there is the BVAS completed, along with a modification of the medication. Now, this is a specialist commissioning condition, and so I'm going to create the multidisciplinary team form for the pre-MDT discussion. So this is the discussion that happens after the clinic, and I'm just preparing for that by providing information which will be used in the MDT meeting. So I'm saying that I performed a BVAS and I recorded a value of 9, and on the basis of my evaluation I believe that a change to the treatment is warranted because of inefficacy of the current treatment, and my proposal is to change the treatment plan of steroid, switch the DMARD to mycophenolate, and to stop the methotrexate. Here we go. And to repeat the biologic therapy with Rixathon. So I'll select that one from the list there. I might have wanted to do some further investigations. I probably wanted some imaging of the chest, so I might order a CT of the chest. I might perhaps have requested a review by my respiratory colleagues, so I'll click that I recorded that I'm going to refer them to the chest physician, and then I might make a comment saying that this patient has GPA and was controlled on rituximab and methotrexate, but now wearing and escalate to an F and higher dose steroid. So I've considered the treatment options for this patient. I've documented them there. This is a patient that would be eligible for a registry study of vasculitis, so I'm going to record the fact that they are eligible, and I'm going to talk to them about the possibility of entering the UKIVAS study, which is all in accordance with the NHS England Specialist Commissioning sequin. I'm going to record and store all that information, and then when I come to my meeting with the MDT team, I'll be able to bring up that information to discuss that patient.